Hi, I'm Scott Erdley, and this is Hal, our high-fidelity male simulator. Hal is an extremely complex mannequin capable of handling a wide variety of clinical scenarios ranging from simple situations to extremely complex drug interactions. You will undoubtedly encounter scenarios involving Hal, so please familiarize yourself with him, and I ask that during your time in the Behling Simulation Center, you treat Hal and the rest of the family with the same respect that you would have with a real patient. So let's talk about his functionality. Hal can be intubated orally and nasally through both nares, although you need to lubricate the airway adjunct with silicone oil prior to any intubation attempt. Otherwise, intubation will be very difficult and is likely to result in damage. Do not use lubricating jelly on any of the mannequins, as it is very difficult to clean the airways. Airway access can be obtained through the cricoid-thyroid membrane in the event that Hal cannot be intubated orally or nasally. When simulating drug administration via endotracheal tube, providers must use an empty syringe. Passing liquids into the trachea or esophagus may cause internal damage. It is recommended that you use a size 4 Miller blade and a size 3.5 Mac blade when intubating Hal. A 7 to 7.5 millimeter tube fits best when intubating orally, and use an 8 millimeter outer diameter nasal airway for nasal intubation. When using an LMA, a size 4 works best. Mouth-to-mouth resuscitation without a barrier device is not recommended, as it will contaminate the airway. Please treat Hal with the same precautions that would be used with a real patient. He has multiple upper airway sounds synchronized with his breathing, including normal, inspiratory and expiratory stridor, and stridor biphasic. Hal is supplied with fixed upper and lower dentures, and the tongue may be moved gently from side to side. Hal has independent right or left lung sounds, which are synchronized with selectable breathing patterns such as Kussmaul's, Cheyne-Stokes, Viot's, apnoistic, apnea, and normal. Available lung sounds include normal, wheezing, inspiratory squeaks, crackles, and rails. The airway contains nominal landmarks permitting either BVM or intubation exercises, including the use of an LMA. In the presence of a pneumothorax, you can perform bilateral needle decompressions at the second intercostal space, and there's bilateral chest tube access available. When placing a chest tube, you will not have to palpate for landmarks and make an incision, but you should follow the process of maintaining a sterile field, placing and securing the tube, and attaching it to a chest drainage system. Hal can also handle normal CPR procedures and has bilateral O2 saturation sites on index fingers. Hal is equipped with several realistic heart sounds which are related to the user-defined heart rate and cardiac rhythm. IV, IM, or sub-Q access can be performed using only needle sets size 22 or thinner to extend the life of the veins and skin. Sites on the upper left and right arms and legs permit IM injections where fluids are actually administered. Hal's conductive skin sites allow the attachment of real electrodes and defibrillator pads. This feature permits the user to track cardiac rhythms and events with their own equipment, just like with a human being. Hal can be shocked or paced with real energy for cardioversion, defibrillation, and pacing drills. Keeping that in mind, it is important to take all precautions when using the defibrillator, since it passes real electricity and there is potential for serious injury. An AED will display Hal's ECG, analyze his cardiac rhythm, and advise action. Hal has palpable pulses that are dependent on his blood pressure. Available pulses include carotid, brachial, radial, femoral, and pedal. Distal pulses can be disabled to simulate severe hypotension. A manual blood pressure can be obtained bilaterally by placing the cuff around the upper arm with the cuff mark at the medial site of the bicep brachii, about an inch above the anterior elbow, which is the correct site when taking the blood pressure on real patients. Inflate the blood pressure cuff and then auscultate corticoff sounds as you would a normal patient. I'm sure you will agree that Hal is an amazing piece of technology, but he does have a few limitations. While listening for lung and cardiac sounds, as with all of the mannequins, you will hear mechanical sounds from the pump. So please take time during your orientation to distinguish the mechanical sounds from the heart and lung sounds. Hal cannot stand and or ambulate on his own, so he will need assistance if he is expected to move. Hal does not have a stomach, so please do not administer any oral medications or fluids, and you will not get any return from a placed nasogastric or oral gastric tube. Betadine, pens, and markers will permanently stain the skin, so do not use on Hal or any of the mannequins. Avoid using plastic and cloth tape when securing tubing. Use only fabric tape to prolong the life of his skin. Please remember that he is a plastic mannequin, but he still deserves the respect and treatment that you would give to a real patient. I look forward to seeing you in the lab. Thanks for watching.